So I want to talk for a minute about how to teach the brain. One of the really important things that we know in trauma is that when we help people understand the injury trauma creates in the brain and help them understand how that impacts the way they respond to other events in the world, it really helps them and their families move forward in their healing. So lots of people have given ways to teach the brain. As a practitioner myself, I've taken a lot of the models from Dr. Dan Siegel, taken models from the Hahn Foundation for teaching in the optimistic classroom, and looking at some of the things Ledoux has done, and put them together and really challenged myself and folks that I educate about practicing really teaching the brain. So when I explain this to teenagers, I start with the hand model, okay? And I start by explaining that we're going to talk about the downstairs brain and the upstairs brain that everyone has. Formally, this is called the limbic system, and this is called the cerebral cortex. But what we're going to talk is downstairs brain and upstairs brain. So in your downstairs brain, this is where fight, flight, or freeze lives, okay? When threat comes at you, your body has 3 reactions it can make. It can fight, it can run away, or it can stay very still until the danger's gone. That's what this brain does, okay? This part of the brain. What's up here, the upstairs brain, its job, among many other things, is to solve problems, to help you calm down, solve problems, okay? And to tell the downstairs brain, I got this. We're going to be okay. There's another solution. So what happens a lot of times to kids who've experienced trauma is if you think about these like muscles, because you've gone through a lot of threat, this downstairs part of the brain's been doing push-ups your whole life, okay? So this part of the brain's really strong. The part of your brain that solves problems hasn't had as much exercise because you've had to be really strong to be a survivor, a thriver. So what happens is that the brain gets what I call emotionally hijacked. This downstairs brain comes up on top of this brain, it takes over, okay? So the downstairs brain's in control. And so you fight, you run, you freeze. The only things that work when you're down here are things that calm you down. So we call them self-regulation skills. And that happens from connection. Somebody talking to you, helping you breathe, helping you feel your body calm down. Once that happens, then the upstairs brain can come back, and then you can solve problems. So that's how I try to explain to teenagers the downstairs brain and the upstairs brain, and what happens to them when they experience a threat. With young children, what I've found is they like animals. When I say young, probably 3 to 8 years old. Sometimes teenagers like it too. And so what we call this is the downstairs brain, that threat center again, is what I call the barking dog. If you think about when any noise or threat makes, usually a dog will bark. So this is the barking dog, okay? A problem solver is often called the wise owl. So upstairs is the wise owl, downstairs is the barking dog, okay? When the dog barks, the owl flies away. And so when the dog's barking, the only things they can do are maybe practice blowing bubbles, maybe practice breathing deeply, things that help the dog start calming down. And that's where you build their self-care strategies. They practice lots of different things to help the dog stop barking. The first skill being recognizing when their dog barks. Once they learn how to calm the barking dog, then the owl flies back, and then they can come up with solutions. And again, they're trying to get this muscle stronger. The problem for most people who are intervening, if you're talking to a family, most parents are going to naturally start with redirection and consequences for negative behavior. That's the first place they go. They're shaking fingers and telling somebody, stop that, you need to do this. That's an upstairs brain intervention, while most children who've experienced trauma are downstairs. So the term Siegel uses is you connect, then you redirect. The only thing that will calm a barking dog or the downstairs brain is helping that child calm down. And only then, once you teach the child to calm down, can you engage the part of the brain that solves problems and actually come up with solutions for better behavior choices. And that's why it's important to respond to the need, respond to the safety needs that get kicked up by threat, and not just react to the behavior that happens.